The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, or morning for those on the West Coast or in Hawaii. My name is Sarah Weiner, Program Manager of Education and Practice at the Association of Schools and Programs of Public Health. Thank you for joining us for today's ASPPH Presents webinar, Delta Omega Innovative Public Health Curriculum Award Honorable Mentions. Today's webinar will be 1 hour in length. We will begin with a short introduction of our presenters, followed by their presentations, allowing time after each presentation for a few questions, and then concluding with additional time for questions and discussion. This webinar is the first of the 2018 ASPPH Presents webinar series. And this webinar is being recorded and it will be available on the ASPPH website in the archived webinar section soon. All registrants will receive an email with the link to the posted recording and slides when they are available. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit. A few housekeeping items of note. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. We are pleased to have with us today our speakers, Elizabeth Van Nostrand, who is representing the Delta Omega Omicron chapter at the University of Pittsburgh Graduate School of Public Health. Elizabeth is an assistant professor in the Department of Health Policy and Management at Pitt Public Health, an adjunct professor in the University of Pittsburgh School of Law, and the director of Pitt Public Health JD MPH program. She currently teaches public health law and ethics, current issues in health law, and law and public health practice in both schools. For the past 2 years, she was nominated for the Craig Award for Teaching Excellence. She is also the director of the Mid-Atlantic Regional Public Health Training Center. Elizabeth has co-authored 3 bench books on emergency preparedness law and previously was an attorney specializing in litigation with the United States Department of Agriculture. Our second speaker, Michael Fagen, is representing the Delta Omega Beta Eta chapter of the Northwestern University Master of Public Health program. He is a faculty member in Northwestern University's Feinberg School of Medicine's Department of Preventive Medicine, where he directs the Institute for Public Health and Medicine's MPH program and is founding chief of the department's Public Health Practice Division. Previously, Michael was on faculty at the University of Illinois at Chicago School of Public Health, where he directed the Mid-America Center for Public Health Practice. Michael is committed to training the next generation of public health professionals. To this end, Michael transformed Northwestern's Topics in Public Health course from a loose amalgam of seminars into a coherently themed one-year sequence that anchors his MPH program's core coursework. And rounding out our speakers today, Denise Nelson-Hurwitz, who is representing the Delta Omega Gamma chapter of the University of Hawaii Office of Public Health Studies. Denise is the BA Public Health Program Chair and an assistant professor with the Office of Public Health Studies at the University of Hawaii Manoa. She is credited with the development of the newly instituted Undergraduate Public Health Program in 2014 and the Capstone series in which students present projects on community-based service learning and research. She seeks innovative approaches that allow her students to experience their education through evidence-based student engagement and team-based experiential learning techniques. Thank you all for presenting today, and I am going to turn it over to our first presenter. Elizabeth?
Thank you very much, and good afternoon, everybody. I want to thank ASPPH for facilitating this opportunity and Delta Omega for this wonderful award. I'm going to tell you a little bit about the genesis of this course, how it's grown, and share some of the challenges I have faced in teaching it. And as Sarah noted in her kind introduction, I'm an attorney who's practiced and is currently teaching public health law. For those of you who may be unfamiliar, public health law is a relatively new discipline that combines elements from legal practice that are relevant to work of health departments. In 2014, I, along with 9 other attorneys from across the nation, we were fortunate to receive a fellowship from the Robert Wood Johnson Foundation that focused on excellence in public health law education. As part of the application requirements, we were tasked with creating an innovative class for public health students. I designed a class called Law in Public Health Practice. And what it is a multidisciplinary practice-based course offered at the University of Pittsburgh. I'm currently teaching the 4th iteration of the class. I've had students in all 6 departments within Pitt Public Health. I've had students from the schools of law, nursing, and medicine. I've had a couple of undergrad students take the class, and these students were interested in pursuing a career in health sciences. I've had Masters of Health Administration students, and also some students in policy from Carnegie Mellon University. Together, we partner with the Allegheny County Health Department, which is the health department that serves the county in which Pittsburgh sits, or other organizations within Pittsburgh who have an issue that needs the expertise of a multiple cohort. And the issue has to relate to some public health law or public health policy matter. The course meets for 2 hours a week for 15 weeks. And during the first class, the first thing I tell students is that it takes a lot of work. And this is not because of me, but it's because of the high expectations of the students themselves. The class incorporates didactic and theoretical components as well as professional development elements. There are very few course requirements, but I have listed here some of them. The class is in part skill-based. After the first couple of sessions, the students lead the class like a business meeting, including the preparation of an agenda, leading the class, managing time, and introducing any guest lecturer. Eventually, one student is designated by their fellow classmates to fill a project manager role. And that individual makes sure that the project is progressing according to whatever Gantt chart or other timeline or work plan that's developed by the class. One requirement is that the course needs to culminate with some sort of deliverable. And those deliverables have to include a white paper and a presentation before the director of the Allegheny County Health Department, her leadership team, and a variety of invited community stakeholders. The students are responsible for sending out both the invitations and the thank yous. The Allegheny County Health Department has rulemaking authority, so if appropriate, the students draft model regulations. Depending upon the number of students in the class, a collaborative team approach is used and the students self-segregate into groups. The only requirement I have is that they cannot remain solely within their educational silos. What that means is law students can't be the only ones who are developing legal research, and public health students aren't the only ones assigned to develop assessment tools like surveys. For our first endeavor, the Allegheny County Health Department and I decided to have the students examine the possible regulation of tattoo parlors in Allegheny County. This was an area of interest for the health department for several years. Pennsylvania does not regulate tattoo parlors at the state level, but a few of the local jurisdictions do. So to begin to familiarize the class with the tattoo process, we visited a local body art establishment. We spent about an hour at the shop. We watched a tattoo being created, and we interviewed the proprietor and other employees about their industry. The students then did an interjurisdictional comparison of tattoo regulations in 7 different states to determine best practices. They also looked into the economic ramifications of regulation, like if there were regulation, who would monitor compliance, and they investigated health outcomes associated with inking. They even used SurveyMonkey to pose questions to every tattoo parlor in Allegheny County. And they asked questions to them about safe practices, such as, do you use disposable products? And what do you do with used needles? As well as educational experiences, such as whether the employees had ever taken an OSHA or similar blood-borne pathogen training. The students even developed safety tips and other information for the Allegheny County Health Department to post on their website and distribute through community-based partners. Here is a flyer that I used to advertise the next offering of the course. For the past 3 terms, we focused the class on the opioid epidemic, which is an enormous problem in Allegheny County. Again, the students have looked at economic costs, such as the estimated costs associated with crime and health costs and worker productivity losses, health outcomes, and cost-effectiveness analyses, including analyzing hospital care costs for overdoses with and without the use of naloxone, which is the drug that's given to folks who are experiencing overdose, the cost of providing naloxone kits, and the number of deaths naloxone prevents. Local, national, and international case studies are used to examine established harm reduction programs, and legal analyses are performed to identify gaps and barriers to treatment. The students have performed GIS mapping of pharmacies that stockpile naloxone, and they've cross-tabbed them with aggregated overdose deaths. One of the classes even used a regression model to examine the presence of Good Samaritan laws and drug overdose mortality rates. Ironically, this term's class met for the first time yesterday. And I think what we're going to do is explore the impact the opioid epidemic is having on children in Allegheny County. Both kids who go through the judicial system, such as family courts and drug courts, as well as the social welfare system, like kids who are placed in foster care when their parents overdose. This time we're going to work with the Allegheny Child Death Review team. And this is really interesting because it also reflects a multidisciplinary approach to problem solving. On the board are physicians, health department professionals, EMS professionals, social workers, attorneys, and other people interested in addressing this overwhelming problem. Here are some of the challenges I face. The first one was, how could I attract students to this strange new course? To combat this, I drew upon my professional relationships to advertise a class. I pitched it during any and all guest lecturing opportunities I was given, and I distributed flyers such as the one on the previous slide throughout the university. And I think most importantly, I've tried to come up with topics that are appealing to students as well as necessary to our practice partners. And fortunately, it must have worked because last term I actually had to turn students away. It was difficult to structure a class like this because I couldn't just borrow anyone's textbook or syllabus. I had to walk a very fine line between approaching this as an anything goes type of course and imposing a structure that would be too rigid to allow for student-led change. This time, for the first time, I'm actually allowing the class to develop their own syllabus. I presented them with a skeletal syllabus yesterday with assigned readings every week and a couple of lectures that I'm going to do based upon my past experience. I know that they've been very useful to the students. But other than that, I've given them kind of a menu. I've given them a menu of different lecturers who could come and talk to them, different resources that they could tap into, and I would like them next class to come up with a syllabus that's going to be very meaningful to them. So stay tuned. I'm hoping this ends up being a good thing. Another challenge I faced was I didn't even understand how to get the course approved through my own school. So how could I actually navigate it through both Pitt Public Health and the law school? As it turned out, it was too difficult to have a class listed at both institutions. But Alan Meisel, who leads the Health Law Certificate program at the School of Law, was gracious enough to allow law students to get credit from my Pitt Public Health class toward their requirements. I assess students both individually and collectively. Everything I assess them on is based upon rubrics, which I give the students at the beginning of the semester. I individually assess the students on both student-led discussions and professionalism. The students assess each other twice during the course, once midway and once at the end. And they all receive a collective grade on the final deliverables. And finally, keeping my type A personality at bay can be a toughie. As a parent of 4 children, a former litigator, and the leader of several research teams, I'm used to kind of acting like a benign dictator. In this class, though, I try to play the role of an advisor, as a mentor, and a guide, but not as an editor. This experience has taught me the value of letting go. And it has also confirmed the adage that when you encourage all participants to buy into a process, the result is dedication and pride in the work product. This theory is supported both by the student evaluations I've received and with end user satisfaction. I'm delighted to report that each time I've led this class, the Allegheny County Health Department has forwarded the students' white papers to both other constituents, other executive branch agencies, and to elected officials in Harrisburg. That's all I have for you. Thank you so much for your attention, and I look forward to any questions you may have either now or at the end of the presentations.
Wonderful. Thank you so much, Elizabeth. We do have time. We'll just take one or two questions now. I want to remind everyone that they can submit their questions by typing them into the question box to submit and to be asked of our presenters. This participant asks or notes that you limit your class to 15 students. Have you found that to be the kind of golden number, or could you see that this class expanding to a greater number?
For a sole leader for one professor, actually 15 students is too many. The last time when I had to turn students away, it was a little bit disjointed. It was too many people almost to come to consensus, and this class is about consensus building. This time I have fewer students, and I think the ideal number would probably be somewhere between 6 and 9.
Wonderful.
Or else I'd have to get another instructor to help.
Understandably. And then as a follow-up question, let's see here. What proportion of law versus public health students have you found to be taking this course?
I have more public health students enrolled than law students. I think partially that's because my primary faculty appointment is at Pitt Public Health and more students know me. Also, students in the School of Law, I hate to sound kind of cynical, even though these are kind of my peeps because I'm a lawyer, but a lot of the students at the law school want to know how a course is going to help them pass the bar. And although my public health law class that I teach there actually is very useful to them because it's almost all constitutional law, this is more of a practice-based class. This is really drawing upon a variety of skill sets. And so I would say that if I had to do it proportionally, I probably would have 2 or 3 law students, maybe 5 or 6 students from public health, and then the remainder from different schools.
Wonderful, thank you. And I'm going to now invite our next speaker and remind that our participants that they can submit questions at any time through the question box. And I'd like to invite Michael Fagen to take over.
Great, thanks very much, Sarah. And like Elizabeth, I want to thank ASPPH and Delta Omega for this wonderful award and this great opportunity. And Elizabeth, loved your presentation, and I think that those in the webinar will see a lot of similarities between what we're doing at Northwestern and what Elizabeth is doing at Pitt. So a brief overview of what I'll present to you in the next 10 minutes or so. I want to start by introducing Northwestern's program in public health, and then talk specifically about the Foundations of Public Health course that we often just call Foundations here at Northwestern. So I found that many people don't know Northwestern has a public health program, and I'll admit, as someone who's been in Chicago for some time, I didn't know that either until I moved over to Northwestern about 3.5 years ago from the Illinois Chicago School of Public Health. But the Northwestern program has in fact been around for over 20 years now. It was launched as an MD MPH program. Northwestern, as many folks probably know, does have a strong medical school and MD program, and has been fully accredited by CEEF since its first day of eligibility. I'm sure some of you in the webinar will appreciate this. We just went through our reaccreditation site visit and expect our positive result from the SEAF Council next June. So that's been taking a lot of our time recently. Some of the key features of our program are that we're small. Our MPH has about 100 students in it, about half of whom are MD MPHers. And then we have other categories of dual degree students who are either doing PhDs, doctorates in physical therapy, and a few other degrees alongside the MPH. We do have a good chunk of students who are doing the MPH as a standalone degree, either part-time as working professionals, or in a new variant for us as one-year students where they do a very intensive full-time one-year MPH. And in our most recent variants as 4+1 students. So these are Northwestern undergrads who are highly qualified and have already showed interest in public health and seamlessly move into our one-year MPH during their 5th year at Northwestern. We do have a sister program in our program for public health, which is an MS in biostatistics that has about 15 students who are mostly one-year full-time students. And I do want to reemphasize that we're located in a medical school, which really comes with its own strengths and challenges. So we are not a school of public health, but rather a program located in a medical school. So this course, Foundations of Public Health, and I'm presuming that many of you have a similar course in your MPH program. It's required as part of our MPH core. You heard about all of our different kinds of students. Every single first-year student, and for our one-years, that means they're only a year with us, needs to take this course. It's required. It has a somewhat unique structure. At Northwestern, we're on the quarter system, so the main academic quarters are fall, winter, and spring, although in our MPH, we do have a summer quarter, and in the 1 year, we utilize that to the full extent. But for this course, Foundations, it's 1 hour a week in the fall, winter, and spring quarters, and as a result, over those 3 quarters becomes the equivalent of the 30 contact hours, 1 unit at Northwestern, 1 quarter full-time course. Each of those quarters has a theme. The first quarter's theme is fundamentals. In the second quarter, we focus on applications. And in the third quarter, leadership. So the purpose here, as you're probably figuring out, is really to ground students in the key frameworks, values, and activities of public health practice in particular, so that all these different kinds of students, whether they're going to be practicing primarily with their MPH or primarily as a clinician, but using their MPH skills, really understands what public health and public health professionalism and practice is all about. This course is very interactive. The way that I and my instructional team teach it involves a lot of back and forth with the students, discussion, in-class activities, and the like. And I'd say one of the key features is that from the outset, really the second week of that fall quarter, we split students into interdisciplinary groups, and as you can tell from our student population, there really is a lot of interdisciplinarity there. And students stay in those groups of 4 to 5 students for the entire 3-quarter sequence. And the biggest thing they do in those groups, which is another key feature of our course, is experiential learning via a partnership we have with the Chicago Department of Public Health, and more specifically, it's Healthy Chicago 2.0 initiative, which for those of you who know health departments, is really its I-plan. It's a plan for achieving health equity over a 4-year period. The assignments in many ways provide the heart and soul of the course and really, at least to my mind, promote the most student learning. So related to the Healthy Chicago 2.0 initiative, in groups, the students do an analysis of one of the strategies in that plan. There are 240 strategies in that plan. It is a humongous plan, in many ways unwieldy, but certainly very ambitious. Students select 1 or 2 strategies in a specific category to focus on, and in the fall, they analyze those data and other things that promote that strategy. In the winter, we actually connect them with implementation task forces, folks from the health department and local nonprofits and others who are working to implement that strategy. And they not only help do that, but they create a plan for further implementing it, or in some cases, the strategy is really just laying dormant, and it's the students that provide the catalyst for implementing that strategy. And by the end of the spring quarter, we expect that the students will have done something significant related to that strategy on the ground and will be able to report on it to the larger class. They do that in a poster gallery that's really a lot of fun, and where all of these implementation leads from the community and from the health department come and interact with the students. Alongside those group assignments, they do have a series of individual assignments related to Healthy Chicago 2.0. They do an evidence analysis related to their strategy, and each individual student's evidence analysis then folds up into that group assignment. And in the winter, they do a stakeholder analysis, that in service of the implementation plan that they're working on for their strategy. Big part of this class, though, as you can tell, is also getting the students thinking about their public health professional careers. So we use the competency assessment from the Council on Linkages, those core competencies for public health professionals, and have the students self-assess on those. In the fall, in the Tier 1, those are the entry level. Then in the spring, when they're towards the end of the course, or even in some cases they're MPH, on the Tier 2s, those are the competencies for entry-level MPH folks. And finally, by the end of the spring quarter, we have them producing a vision statement for their public health professional future. So that's an awful lot, as you can tell. Like Elizabeth, I think we are really challenged to cram all of this into a single course. It does have that longitudinal nature, which is helpful, so it stretches over 9 months, but the reality is we only have 30 contact hours over those 9 months. And as I was mentioning earlier, this city health plan, Healthy Chicago 2.0, really is a beast. So getting the students meaningfully connected with those implementation leads, having them help those students, having them help those leads do things on the ground, that's a challenge, and we're getting better at it as the years go by. Learning by doing is how we operate in this course, and that's messy because it's always messy to learn by doing, and public health by its very nature, especially implementing a huge initiative like Healthy Chicago 2.0, is extremely messy. And I know for many students, they find that frustrating, especially the clinical students who are used to what I would call cleaner approaches to both education and to learning. And it's hard for many of them to wrap their brains around the messiness that really is doing public health in practice. And we do have this diverse set of students. So we have these clinicians in training. We have students who are straight out of undergraduate doing a 1-year MPH, and we have MD fellows who are adding to their training with an MPH. So trying to meet the needs of all those kinds of diverse learners in a single course is pretty challenging, as you might imagine. As with any course that I teach and really any project I undertake, we're always doing revisions. So one of the things we've done this year for the good is connect the students to those implementation leads much earlier in this 3-quarter sequence. And these individual assignments that I just described to you are actually new for this year. We didn't have them last year. And if fall quarter is really any indicator, they're going to be very helpful, both for the students individually and for their groups as they work on their collective projects. Vision statement, I think what we're going to need to do next year is actually have them create a draft, probably in the fall quarter, that just gets them thinking about this. We were discussing this as an instructional team the other day, and we realized that having them do a vision statement cold in the spring is probably a little too late and a little unfair to them and to us. So I think we'll change that up next year. The other thing we'll do, for those of you who are familiar with CSNU new accreditation criteria, is work to meet all of those 12 foundational knowledge objectives with this course. And many of them are already in there by nature, but 3 or 4 of them are going to be, well, infused might be a nice way to put it. Sometimes it feels like they're a bit of a force fit, but we'll manage, we'll get them in there, and that's one thing that we're working on for next year. And another thing we're working on for next year is the course structure. So we'll certainly keep this 1 hour a week over 30 weeks and 3 quarters. But we're going to pilot a 1-quarter version of this in the fall and see if it's feasible to meet these same course objectives and do the same thing with it in a 1-quarter, more concentrated dose alongside that 3-quarter less concentrated dose. And that should be a nice little natural experiment for us to see how those two compare and whether one version is somehow better than the other or both make sense. So that's what I have for you today. I really do encourage any of you who are doing something like this to be in touch with me. There's my contact information. This is very much a work in progress, as you can tell, and I would be very appreciative of any discussions with anyone who's thinking about these things or doing them in some way, shape, or form.
Thank you for sharing all of this fantastic information about this beast of a course. We have time for just a few questions, and then we'll take the rest at the end of the presentation. But this participant asks, how many people are involved in your instructional team for this course? It does seem like a lot of work for meeting only 1 hour a week.
So that's a great question. In my first year at Northwestern, I did it alone. Huge mistake. In my second year, I recruited a TA, much better. And this year, with our rising enrollments, I recruited a co-instructor and 2 TAs. And that's a good, solid instructional team. We have 37 students in the course. So 2 instructors, 2 TAs, I think, is a good ratio for those 37 students.
Great. And then a question kind of about the nuts and bolts. Considering the diversity of your students, how do you facilitate the group assignments to encourage the diversity that you had mentioned?
Right. So we're very intentional about the way that we actually assign the groups. We have a whole matrix that we use. We ask the students to do what we call a background and experience survey the very first week of class. So in addition to knowing what degree variant they're in, we also get a sense for their work experience in another public health, a basic sense for their maturity level, and in general, how we think they might operate in small groups. And we really do make those small group assignments intentionally. And, you know, it's like alchemy. I mean, sometimes it works wonderfully and other times not as much. So we do have some checks and balances. By the spring quarter, we're having them do both self and peer assessments in their groups. And we make it very clear that if there's some issues in their groups that they simply can't handle themselves, that we as an instructional team are ready and willing to help them solve them. But so far, no disasters with the group. So hopefully I haven't jinxed us by saying that out loud. But, you know, that is, it's a big challenge for sure.
Yeah, I hope that good luck continues to follow you. And just a note, congratulations on completing your reaccreditation site visit.
Thank you very much.
All right, and now I'm going to invite the next presenter, Denise Nelson-Hurwitz. Denise, it's all yours. The floor is yours.
Okay, good morning everybody from Hawaii. And so today I'm going to be sharing with you a little bit more about one of our undergraduate classes, which is Applications of Public Health Principles in Research and Practice, and it's part of our capstone course or series. Before I begin, I wanted to thank ASPPH and Delta Omega for the opportunity to share this with you this morning. Okay. So I wanted to give a brief introduction to our school and our program. And so we're a public university with a very diverse student body. We have primarily local residents. We're part of the social work program, but a lot of our students are also first-generation college students. Some of them need quite a bit of support, which is one of the hopeful goals that we provide through our undergraduate program. Specifically for our department, we're part of the Myron B. Thompson School of Social Work. We've been traditionally a long-time grad program offering master's and doctoral degrees, but our bachelor's program just launched in 2014. So it's been an exciting opportunity for us to engage with a new group of students and at a different level. One of the cornerstones of our bachelor's degree is something that we call the applied learning experience, and it serves as our undergraduate capstone experience. There's a couple of different goals that are accomplished through the applied learning experience that I have here, and it was really an opportunity for students to personalize their degrees. So if you're interested, for students that come into public health incredibly interested in health disparities in a certain part of their community. For students that are interested in developing research skills on cancer prevention, it's really an opportunity in a very broad program that doesn't have a specialization component. It's an opportunity for the students to really personalize their degree and learn and engage a little bit differently with the subject material, and also apply a lot of the public health skills and concepts that we introduce in a lot of our courses to a real world public health issue or topic that they're particularly interested or concerned about. And this is also an opportunity in our capstone experience for our students to focus a little bit more on developing professional skills and also strengthen some of our written and oral communication skills that we've been kind of working on and accumulating. So logistically, our applied learning experience is a 3-course series that's taken sequentially over 3 semesters just prior to graduation. So our Public Health 489 class, the project completion and write-up course, is where the class that students would traditionally take just before graduation. The focus of today's course or today's discussion is going to be the first course of this series, which is our Public Health 480 course. So this is applications of public health principles and research and practice. And this is really intended to be a jumping off point and a real opportunity for students to dive in and develop a lot of different experiences and prepare for executing the projects that they're going to be proposing. So there's a lot of preparation built in, but it's also traditionally and classically a research methods course to really provide students with the tools and the skills that they may need as they enter or as they move out into the field. So we have the course. It has many objectives. It's a jam-packed course with lots of interaction, and it's usually logistically it's taught twice a week for an hour 15 minutes each. Is 3-credit course. I usually have between 20 and 30 students enrolled in any given semester. There are 3 prereqs for students before they can begin this process. They have to have taken our Introduction to Public Health course, so just our basic intro, our Introduction to Epidemiology course, and then they also are required to have a brainstorming meeting with our academic advisors that really help them to articulate what is something in public health, what is a specific public health topic or issue that they're particularly excited or interested or concerned about. And so as they enter the course, they've already started that kind of initial brainstorming process. So a couple of the different objectives that I just wanted to highlight this morning, we focus a lot on reading and interpreting scholarly literature. We talk a lot about how to best glean kind of academic information. For a lot of our students, this is relatively new, and they see academic literature as somewhat challenging. So we go over things like study critique, which is something that they should be prepared for in our epidemiology course. How do we look at study design? How do we interpret the findings? And how can we use the academic literature that's been published to link and connect to the topic that they've chosen, and also to other pieces of literature that's available. It exposes students to a lot of interdisciplinary practices and a lot of real-world public health research projects. So we do have, especially for the first half of the semester, something that I call Public Health in Action Profiles, where we invite our faculty and other researchers on campus to come in and talk about their research projects, their research practices, so that students, as they're developing their own projects, really have a sense of what public health practice and research looks like in the field. So hopefully to provide some inspiration for students for methodology, for different approaches, but also to in some ways connect students with potential mentors or organizations or sites that they may be willing to or interested in working with. We focus a lot on professionalism, professional skills. We focus a lot on critical thinking and also building both written and oral communication skills. And so hopefully, again, this is the Launchpad course that will prepare students for doing their own independent either research or service learning projects in the next course that they take. One of the highlights of this course, there's one major written component and one major oral component. For our written component, students are required to develop a written proposal that they draft in segments throughout the semester and then turn in as a final write-up at the end of the semester as their kind of equivalent of their final exam. In this proposal, they really look at learning more depth of information, of high quality information. We talk about that extensively on the topic that they've chosen. So for example, I've had a student who was interested in working with suicide prevention, primarily among LGBTQ communities, and they were interested in doing a service learning project. So they'll look up what are risk factors for mental health challenges, what is being done nationally, what is being done locally to really address some of these challenges, what particularly about this population makes them more vulnerable to higher suicide risk. In their significance, they look up a lot of data. They look up what is our incidence, prevalence of what's going on either nationally or locally, and what role may their project in their methodology, what role may their project play in addressing this challenge. In their practice component that they would complete in 485 in the subsequent course, they would be working. This example student is working with Mental Health America, a local chapter of that, and doing a needs assessment in collaboration with them, and also some outreach components. That's for roughly 100 hours that they're working with the organization. So this is a little bit of, this is the primary focus that we have for the written component. And I'll talk about the oral component in a minute. A couple of helpful strategies that we've found through the evolution of this course. This course has been taught for roughly 4 years, or 3 years, I'm sorry. So roughly about 6 semesters, because it's taught twice a year. The public health and action profiles are always one of the most positive components that we get feedback on from the students. Meeting with a lot of different faculty members, seeing them as more than just instructors, seeing them in a research role, understanding the kinds of projects that they've been working on, understanding some of the processes and what they encounter on more of a daily basis. In some ways, it can become kind of a day in the life kind of scenarios. And for the faculty to try to ease the burden of the request and asking them to participate, I asked them to come in and for a 10-minute presentation. It can be informal. They can use slides or not, and just talk a little bit about their research practice and projects. And that's always been important component of the course. We also have multiple sessions on reading and interpreting scholarly literature. Again, this is an area that a lot of our students really struggle with, especially in their upper division courses. And so we spend quite a bit of time doing team-based learning. We do a lot of assignments, working in groups to interpret and share information, how to present it orally as a group, how can they connect it to a larger topic. And so we have a lot of practice on that component. There's also a lot of professional development that we incorporate in for students to really think about as they're about a year from graduation. What do they want to do after graduation? Are they interested in graduate school? Are they interested in career building? What does that look like? I operate primarily on a flipped classroom model. because there is so much content to cover, and it is in many ways student specific because it's specific to their projects. A lot of the baseline rote content is the students will read online or read from a textbook that I use. And then when they come to class, they're able to apply it to their specific projects. So they're able to look at either working in groups for in kind of practice topics or applying it to the specific topics that they've selected. So that's been an incredibly helpful model for us to use. Another thing that we've built in extensively throughout the course is a lot of writing support. So we have a writing TA that helps support the class. We have students go through. Our librarian comes in and talks about developing a search strategy. We check their references, a list of their references before they start writing their papers. We have them do outlines, drafts. They get feedback on all of these different components. And so the hope is that their final written proposal is a very strong piece of academic writing that they can then take to a site or an organization moving forward. Last component that I'll talk about today is our Undergraduate Public Health Summit that we have each semester, and it's an opportunity for students to present orally. So they all develop their own independent poster presentations of their project proposals, and they have an opportunity to share that at a public format with a lot of our faculty, our community members, alumni, and they present their projects, the literature reviews, the significance, a lot of the statistics that they've been looking up, and the proposed action that they'd like to move forward with. It's also an opportunity in the 480 proposal students present for an hour. After that, our 489 or our graduating students present their completed projects as posters as well. And this has been a really invaluable experience for our students in developing a lot of professional behaviors, professional skills, oral presentation skills. It's opportunities for them to get feedback on their proposals from kind of the public, from community members, from faculty, and also an opportunity for them to meet with mentors that they may be working with in their next component. So thank you very much for your attention, and I'm very happy to entertain any questions. Otherwise, I'm very excited if you have any questions that you think of later, or if you're interested in learning more about our program or our classes, I'm very happy to help or take any questions. Thank you very much.
Wonderful. Thank you so much, Denise, for sharing that. A few questions specifically about your program, and then I'll open it up and address further questions for all of you for the other presentations. This person asked, do you provide a listing of the topic options for your students, or is the onus put on students to choose their topic of focus?
Okay, so a lot of our students, some of our students come in, it's primarily on the students to decide. And that's one of the reasons why we have a component where they have to meet with an academic advisor before they're able to register for the course. And the academic advisors really look at, well, what are some topics that you were interested in some of the classes that you've already taken? What are some experiences that you may be interested in? We have that brainstorming process, and then we do share a list of project topics and mentors and sites that we've had in previous years with the students. But we do ask them to come up with a few options on their own before we provide them with that information. So one of the intents is we really want students to be invested and excited about the projects that they pick. So instead of, we don't want to make it so easy that they just pick from a list. We want it to be something that is important to them.
Certainly makes sense. All right. And then as another question, you had mentioned professional development that you provide in the class. This person asked, is that primarily via conversation in class, or is it more via self-reflection assignments?
Okay, so both. We're emphasizing it a little bit more as the course is evolving. So it's really looking at what are the skills that a student already has that can be an asset to them moving forward? What are some skills that they may need to work on? So there's a self-reflection component that goes into that. But we also talk a little bit about teamwork, collaboration. I'm bringing in guest speakers to come in briefly and discuss what are some best practices that they've seen among the students that they've hosted in the past. What are some skills that employers are looking for that we may need to develop or may need to work towards before students go into graduation?
Great, thank you so much. And then I'm going to remind all of our participants that you can submit your questions for any of our presenters using the question box. The next question I think is pretty much geared toward all of you. It'd be nice to hear your take on it. What advice do you have for engaging practice partners? A lot of you had noted that you invite them to guest present in your class, but outside of that, any recommendations?
I could take a stab at this. This is Michael Fagen from Northwestern. I think for me and for us, it's really predicated on either existing relationships with practice partners or newly formed relationships that in some way show benefit for both sides. So as mentioned, I came over from the UIC School of Public Health, and I've been in Chicago for about 20 years. So really have a sort of large network of public health practice partners that I was able to draw on. And even moving over to Northwestern, was able to meet colleagues in the new university setting who also had some good networks of colleagues in the public health practice world. So I suppose my advice is to really capitalize on existing relationships and networks. And I know in my experience with the public health practice world, folks are really, really willing to help. And if your students or you or your fellow faculty members can help them in some way, shape, or form, whether it's to collect some data, analyze it. I know so many public health practitioners just really need some help working with data. Then it can be a win-win for both sides.
I would echo that as well. This is Denise from University of Hawaii, and looking at building on existing partnerships that myself or our faculty have has been a really great start to having those conversations. And a lot of our community partners are very interested and excited to work with our students. But also for us, our students have been incredible ambassadors. And so we have a lot of students that have been proactive and gone out into the community to find potential mentors or potential organizations to work with that they're excited about. And then after the student returns, having completed the experience, a lot of those community partners have come back to me and said, do you have any more students? This was a really great opportunity for us to really take, either focus on evaluation or improve our outreach efforts, refresh some of the things that we've been wanting to accomplish, but just get bogged down in kind of the day-to-day activities. And so our students have really been great assets in furthering and building some of those, expanding that network and those connections as well.
And I agree. At first, when I approached the Allegheny County Health Department, I think that they were uncertain as to whether or not this would just be kind of an academic exercise or whether this would really be a true problem-solving event. And I think after they received the first white paper from my students, which is about 50 pages long, filled with really, really valuable things, they were very eager and delighted. So I also point to the students as being very instrumental in the success of this.
Wonderful. Thank you for sharing those recommendations and experiences. Another question, Michael, you had noted feedback you'd received and kind of how you would like to make changes to your course in an ideal world. Elizabeth and Denise, do you have any thoughts on how you would like to ultimately see your course evolve?
I'll go first on that. So as we're moving forward, we have an opportunity. We hired a new faculty member last semester who's able to be our second. So we've doubled our undergrad program in faculty. And so we've really used that as an opportunity to engage in some evaluation. A couple of different things that we're hoping to work on in the next academic year, more writing support for our students outside of class, and really linking that in and making that as appropriate as possible to scaffold what we're already doing in class. Also incorporating more of a technology component. So for example, we do cover basic Excel skills and some computer skills, but at the same time, really emphasizing, okay, as we're going through and learning quantitative research methods, qualitative research methods, focusing a little bit more on efficient data entry, basic data analysis, and using those kinds of computer skills. The professional development piece is also relatively new. It's something that we're really working on emphasizing based on feedback from a lot of our the mentors of our students and community members who are employing our students, just to get the students more experience as they're still in the program with some of those soft employable skills. So there's just some things we're looking at moving forward.
And I would like to kind of marry my public health law class with law and public health practice. I would like to see it be a year-long class and have the first semester be, kind of a traditional public health law class. There is no prerequisite for my class, and this term all of my students have just coincidentally taken my public health law class. So that allows us to hit the project aspect with the ground running, because they already have some basis in what the law is, what regulations are, etc. So that's where I'd like to see it, being a good marriage between theory and practice.
Very cool. Thank you. A lot of great things happening. And then as I think a last maybe quick question is, Michael, this is for you. You noted that your students work on the items from the Healthy Chicago. Do they get to choose the topics or objectives that they work on, or is that something that you assign?
That's a great question as well. That has evolved over the 3 years. This is the third year now that I'm teaching this course in its newly reshaped form. It was free-for-all in year one. We let them choose, I should say I did, anything they wanted. And that actually worked pretty well, although there was some duplication and certain students ran into serious problems given that nothing was going on with their particular strategy or area, or it was just too hard to connect with the people on the ground who are working on it. So last year we went to a survey that asked the groups about their interests, and we were able to do decent matches. We went for an even tighter survey this year and started it with discussions with our health department colleagues, asking them to identify the 9 or 10 areas where they thought there was both the most work going on the ground and the most need and urgency. And with 8 or 9 student groups, I think we have 8 this year, we were able, with that survey, to give each group one of its top 2 choices. So I think we've refined that pretty well, so that we're really matching health department needs and student interests.
Wonderful. Thank you all so much for sharing all the work that you are doing in your various programs. I think that this has been really beneficial to everyone, and wish you luck going forward with the rest of your spring semester and spring quarter. And in closing, I'd like to remind everyone that this webinar has been recorded and it will be available on the archived event page in the near future. You will all receive an email when it is available, and this has been approved for 1 hour of CPH continuing education credits. Additionally, there will be another presentation of the 4th honorary Delta Omega Innovative Public Health Curriculum honoree, as well as the winner of the award in 2 weeks at the same time, same place. And lastly, I'd like to remind everyone that the 2018 ASPPH annual meeting is taking place March 7th through 9th in Arlington, Virginia, and the Undergraduate Summit on March 7th. Early registration rates end today at midnight, I believe, Pacific time. Otherwise, have a wonderful, hopefully long weekend, and take care. Thank you to our presenters once again.